Hello there. Today we are going to see the critical care medications. Objectives. By the end of this presentation, you will be able to recognize the common critical medications used in the units, identify the indication, side effects, and other important nursing considerations of each medication, calculate the correct dose using the appropriate formula. We find the emergency medications in the crash cart, trolley, as well as in the medication room, as well as in the emergency areas where we can able to get approach to the medications very easily. First, medication like adenosine. Adenosine is considered as the anti-arrhythmic drug. The action of adenosine, it works to treat irregular heartbeat by slowing the electrical conduction in the heart, slowing heart rate or normalizing the heart rhythm. The indications for that is adenosine is SVT. SVT is the supraventricular tachycardia. The dosage is 0.1 mg per kg IV or IO rapid push. We will be giving maximum of 6 mg medication can be given. The second dosage you will be following soon after observing on the monitor whether the SVT got in control or not. Then the second dose we will be giving, that is 0.2 mg per kg. IV or IO rapid push, maximum of 12 mg second dose. In second dose we will give. So in the first dose we give 6 mg maximum, and in the second dose we give 12 mg maximum. This is how the actual SVT looks like in my first strip. That it is showing, that means the QRS complex is very narrow and the R waves are more than 130 to 150 beats. Here you can see first, I will just show. Okay, next is the amiodarone medication. It is also an antiarrhythmic drug. The indication for the amiodarone is SVT and VT with pulse. We see the ventricular tachycardia with pulse, okay, or pulseless arrest VT. In that cases also pulse or pulseless with pulse VT or SVT is the indication for amiodarone. The dosage for amiodarone is 5 mg per kg IV or IO. Load over 20 to 60 minutes. Maximum is 300 mg. Repeat to daily maximum 15 mg per kg, that is 2.2 grams in adolescents we will be giving. Whereas pulseless arrest with VT 5 mg per kg IV or IO bolus. Repeat to daily maximum 15 mg per kg we give. 2.2 grams in adolescents you can give it. So here, when you are giving the amiodarone, it is very important to first check out the heart rate of patient before administering the medication. Atropine is an anticholinergic drug. It increases the heart rate, and it's given in the case of rapid sequence of intubation time where we see the patient is under the bradycardia. So it blocks the action of acetylcholine and reduces the saliva production. And also it is given in the case of toxic medications or post surgery during the operations where the patient will be continuously producing saliva. To reduce the saliva we give it. So the other indications are symptomatic bradycardia and toxins overdose medications. In this case, the dosage is, if symptomatic bradycardia, 0.02 mg per kg IV or IO, or 0.04 to 0.06 mg per kg ET we will be giving. In the case of toxins or overdose, if the patient is less than 12 years of age, 0.02 to 0.05 mg per kg IV or IO initial dosage we will be giving, and repeat the IV or IO every 20 to 30 minutes until muscular Muscarinic symptoms reverse means the patient is able to respond to you we will be giving. If more than 20 years of age, then 2 mg IV or IO initially, then 1 to 2 mg IV or IO every 20 to 30 minutes will be given until muscarinic symptoms reverse. Calcium chloride is an electrolyte needed for maintenance of nervous, muscular, and skeletal system and for the enzyme reactions and blood coagulation. The indications are hypocalcemia, hyperkalemia, hypermagnesemia, calcium channel blocker overdosage. Also, we give calcium chloride. The dosage is 20 mg per kg, that is zero point 0.2 ml per kg. We give IV, slow push during arrest, repeat PRN, that is whenever necessary. Okay, so calcium chloride is usually an electrolyte. Epinephrine is a catecholamine, vasopressor, inotropic medications. The action of the epinephrine it stimulates the alpha and beta receptors within the sympathetic nervous system. Also, it increases the heart rate, constricts blood vessels, increases the blood pressure, and it relaxes the smooth muscles of bronchi and dilates the air passages. The availability of drugs will be like ampules 1 is to 1000 and prefilled syringes 1 is to 10,000 medication. Epinephrine, the dosage of epinephrine is the indication pulseless arrest or the bradycardia, 0.01 mg per kg every 3 to 5 minutes. Maximum dosage is 1 mg will be giving. In the case of hypotensive shock, 0.1 to 1 mcg per kg per minute we give. IV or IO infusions. In the case of anaphylaxis, 0.01 mg per kg, IM we give whenever it's necessary every 15 minutes. Whenever there is anaphylaxis attack shock for to the patient, we give every 15 minutes. 0.01 mg per kg, that is every 3 to 5 minutes. Maximum dosage in the case of hypotensive we give. If the patient is becoming hypotensive, we give every 3 to 5 minutes. In the case of asthma, 0.01 mg per kg subcutaneously every 15 minutes we give in the case of asthmatic attack for the patient. Maximum dosage 0.3 mg or 0.3 ml we administer to the patient. In the case of croup is considered as the infection of the upper airway where the airway becomes very harder and make it difficult for the patient to breathe. In that case, 0.25 to 0.5 mg RAS mix solution, that is mixing in 3 ml normal saline epinephrine we give to the patient. Dextrose is a carbohydrate. The action of the dextrose is to restore the blood glucose levels and provide calories to the patient. And the major indication is hypoglycemia. The dosage in the case of hypoglycemia you give if patient is unconscious or not able to take the oral sugars, juices, drinks, and all. In that case, immediately we will be starting with the dextrose 50%, that is 0.5 to 1 grams per kg IV or IO. Or D50 water 2 ml per kg will be starting, or D25 water 2 to 4 ml per kg, or D10 water 5 to 10 ml per kg will be starting. In the case of severe hypoglycemic attack for the patient, the sugars is literally low to 40 to 50. Immediately, without delay, we will be starting dextrose 50% of water. Lidocaine is an antiarrhythmic drug. Lidocaine action is fast channel sodium channel blocker. It blocks the sodium channel very fastly and affects the QRS complex lidocaine. The indication is VF ventricular fibrillation, pulseless VT ventricular tachycardia, wide complex tachycardia with pulses. If amidron is not available or it's contraindicated, we give lidocaine injection. The dosage is if bolus 1 mg per kg, IV or IO, infusion 20 to 50 max mcg per kg per minute, and repeat the bolus dose if infusion is initiated more than 15 minutes after initial bolus dose we will be giving. ET is 2 to 3 mg per kg by the endotracheal tube you give. Magnesium sulfate is a bronchodilator. The action, it inhibits the calcium uptake and produces a smooth muscle relaxation. Indications for the magnesium sulfate is the Taussig's the point. In the ECG, you can see on the strip dosage the point how it actually looks, and the indication is asthma, refractory status asthmaticus, or hypoglycemia. In these cases we give magnesium sulfate. As it is a bronchodilator, so the dosage consists of, in case of pulseless VT, ventricular tachycardia, and dosage to point, 25 to 50 mg per kg IV or IO bolus. Maximum is 2 grams. We can give the magnesium sulfate. Another dosage is VT with pulse. VT with pulse over 10 to 20 minutes, we give magnesium sulfate, and status asthmaticus, in that case, slow infusion over 15 to 30 minutes we will be giving for the patient. Naloxone, which is an opioid antagonist, it prevents or reverses the effect of the opioid medications, including respiratory depression, sedation, and hypotension. Indications is narcotic reversal or overdosage of the narcotic medications. We give the naloxone. So the total reversal required is for narcotic toxicity secondary to overdose 0.1 mg per kg. IV, IO, ET, every 2 minutes PRN whenever necessary. We give maximum the naloxone can be given is 2 mg. Total reversal not required. Example for respiratory depression associated with therapeutic narcotic usage, 1 to 5 mcg per kg. IO, IV, or IM we can give to the patient. We find the emergency medications in the crash cart, trolley, as well as in the medication room, as well as in the emergency areas where we can able to get approach to the medications very easily. Sodium bicarbonate is an alkalizing agent. The action is it's very concentrated electrolyte, and it usually treat acidosis. Acidosis is pH level is low in the blood. Then the indications is metabolic acidosis, that is severe metabolic acidosis, or hyperkalemia. In this case, 1 milliequivalents per kg IV or IO slow bolus will be given. As in the picture, it's given the stock availability is 1 milliequivalents per ml. Okay, then another indication is sodium channel blocker overdose. In this case, also you will be giving when there is sodium channel blockers overdosage is given tricyclic antihypertensive medication. In that case, you give the dosage of sodium bicarbonate is 1 to 2 milliequivalents per kg IV or IO bolus until serum pH is more than 7.45. You will be giving sodium bicarbonate to the patient. Protocols and the calculations we can see, the platform. When there is severe fluid deficit in the body, we follow 4-2-2 and 1 rule. 4-2-1 rule. So what is that 4-2-1 rule? 4 ml per kg per hour for the first 10 kg of body weight. Then 2 ml per kg per hour for the second 10 kg body weight. Then 1 ml per kg per hour subsequent kg body weight. Like example, patient weight is 25 kg. So in the case of 25 kg, first 10. So 4 into 10 is equal to 40 you will be giving. Then 2 ml per 10 kg, that is the 20 ml you will be giving. Then 1 into 5 is equal to 5 ml. So the total is the 65 ml you will be giving to your patient per hour. How to calculate total fluid allowances for the patient? As ordered, total fluid allowances is 1000 ml for 24 hours. Patient has IV fluid of D5 half normal saline or NGT feeding 15 ml per 3 hours. It's on flow. Then magnesium sulfate is 250 mg every 8 hourly on flow and diluted in 30 ml of normal saline. The magnesium sulfate is diluted in 30 ml of normal saline. So here, what is my IV fluid rate? So here, first 15 into 8 feeds is equal to 120. How you are getting that is your patient feeds. Okay, NGT feeding as we are having 15 ml. So 15 into 8 feeds. Why? Because every 3 hourly you are having the NGT feed. So that you will be taking. Then you have the MGSO4 every 8th hourly. In every 8th hourly, when you are taking, the calculation will come like 3 times. So 30 ml for 3 times you are giving to the patient for 24 hours. So you will get the 90. So the total, you are giving the feed and the MGSO4 30 ml, it's considered as 210. So here what you need to do is, as your patient is having total fluid allowances 1000 ml, so 1000 you are minus with 210. So you will get 790 ml. So 790 ml for 24 hours, you will set the patient D5 half normal saline to the patient, that is 32.9 ml per hour will come. Hope this is okay. I can just say you again that for having the total fluid allowances, like example, patient is just allowed to take 1000 ml for 24 hours by the nephrologist or dietitian have ordered for the patient. In that case, first of all, you need to find out what all the other infusions is going on for the patient for 24 hours. Then with that you will be calculating that all infusions that is very must and should you need to give, like NG feeding or any of the infusions, that you will minus from the total ml of 24 hours. Then what is left, that you will be keeping the other fluids for the patient. Calculating IV flow rate, how we will be setting the IV flow rate in case of highly concentrated medications or inotropic medications, that is mcg per kg per minute. Here you need to make sure the doctor's order, if it is written like mcg per kg is only there, so you will take the drug dosage mcg per kg only. Patient's weight you will be mentioning, where you will not mention minutes in your calculation formula. Or else if the doctor have mentioned mcg per minute, then you will not mention the kg in your formula. Patient's weight you will not take. So if it is given mcg per kg per minute, you need to mention all that, and also you need to add here is the total volume of fluid in which you are adding the total drug strength. So here when we write the formula, it is order amount of drug mcg into patient's weight into volume of fluid into 60 minutes divided by total drug strength, that is the in the mcg. So remember, before doing the calculation, convert units of measurements to one system. Like example, stock in hand is in mg or in the grams. You need to convert it to the mcg based on your doctor's order. Remember and note down that doctor order should never be converted. If it is mentioned in mcg, you need to convert your stock to mcg. If the doctor order is in the mg, you need to convert the stock strength to the mg. If the doctor order is in the grams or the percentage, you need to convert the stock in hand to the grams or the percentage. Hope it's clear, huh? Next is calculating IV fluid rate, mcg per kg per hour. The previous formula was per minute. This is for per hour. So here order amount of drug into patient's weight and fluid volume, that to be divided by total drug strength. Okay, total drug strength will be taken. Coming to the first question, there is a physician order to start injection dopamine at 15 mcg per kg per minute. The premixed IV bag has 200 mg of dopamine in 50 ml. Okay, so the total volume is 50 ml, and the total drug strength is 200 mg. What rate will you set for the IV infusion? So remember, 15 mcg, it's per kg per minute. So here, you can just take one example like any kg of patient per minute, then multiply by 50 ml, that is the volume in which your drug is added to, then divided by 200 mg. So here the mg you will be converting to mcg. So, example, the patient body weight is 15 kg. Just consider like 15 kg body weight. So, here what will be your calculation? 15 is the mcg, the doctor order, into 15 is the patient's weight, and in the question it's for minutes, right? So, 60 minutes. In 1 hour, it's considered as 60 minutes. So, we are taking per minute. If it is the question is for hour, we will not mention the minutes. If it is for minutes in the order, then only we will take like 60 minutes. Then into 50 ml is the volume, fluid volume in which your drug is mixed. So here divided by 200 mg is your dopamine. So that 200 mg you will multiply with the 1000 mcg, because you need to convert the 200 mg to mcg. So 1 mg is equal to 1000 mcg. So you are multiplying 200 mg to 1000 mcg. So you will get 3.4 ml per hour. You will be setting your infusion at this rate. Okay, next is the amiodarone medication. It is also an antiarrhythmic drug. The indication for the amiodarone is SVT and VT with pulse. We see the ventricular tachycardia with pulse, okay, or pulseless arrest VT. In that cases also, pulse or pulseless with pulse VT or SVT is the indication for amiodarone. The dosage for amiodarone is 5 mg per kg IV or IO. Load over 20 to 60 minutes. Maximum is 300 mg. Repeat to daily maximum 15 mg per kg, that is 2.2 grams in adolescents we will be giving. Whereas pulseless arrest with VT 5 mg per kg IV or IO bolus. Repeat to daily maximum 15 mg per kg we give. 2.2 grams in adolescents you can give it. So here, when you are giving the midrone, it is very important to first check out the heart rate of patient before administering the medication. Epinephrine, the dosage of epinephrine is the indication pulseless arrest or the bradycardia, 0.01 mg per kg every 3 to 5 minutes. Maximum dosage is 1 mg will be giving. In the case of hypotensive shock, zero point 0.1 to 1 mcg per kg per minute we give. IV or IU infusions. In the case of anaphylaxis, 0.01 mg per kg IM we give whenever it's necessary every 15 minutes. Whenever there is anaphylaxis attack shock for to the patient, we give every 15 minutes. 0.01 mg per kg, that is every 3 to 5 minutes. Maximum dosage in the case of hypotensive we give. If the patient is becoming hypotensive, we give every 3 to 5 minutes. In the case of asthma, 0.01 mg per kg subcutaneously every 15 minutes we give in the case of asthmatic attack for the patient. Maximum dosage 0.3 mg or zero point 0.3 ml we administer to the patient. In the case of croup is considered as the infection of the upper airway where the airway becomes very harder and make it difficult for the patient to breathe. In that case, 0.25 to zero point 0.5 mg RAS mix solution, that is mixing in 3 ml normal saline epinephrine we give to the patient. Next is baby presented to ER with cyanotic CHD. Cardiologist suggested to start injection prostin at 0.03 mcg per kg per minute. The stock contains 500 mcg in 1 ml, diluted in 50 ml D5W. What rate will you set for the IV infusion? Example, the patient body weight is 5 kg, so you will have your doctor's order 0.03 mcg per kg is the patient's weight 5 kg into 60 minutes, because in the doctor order 6 minutes is mentioned. Then into 50 is the D5W water, that to be divided by 500 mcg is the stock total drug concentration. You will get 0.9 ml per hour. I really thank you all for being part of my presentation. If you really have liked my this discussion, please like, share, and subscribe. I will be very happy. Thank you so much. Thank you for being till here now. Please do like, subscribe.